in a lung cancer survivor. What is trigeminal neuralgia? Trigeminal neuralgia is a sudden, brief, recurrent stabbing type of pain in the distribution of trigeminal nerve whose still etiology remains unknown. Medical management from the conventional system of medicine is carbamazepine, which is the best anti-neuralgic drug at present. But as we know, there can be an unacceptable side effects. When this conservative management fails, then it's the surgical management. The surgical management could be microvascular decompression or brain stereotactic radiosurgery, etc. Then we typical surgical risks of any open skull neurosurgical procedures cannot be withdrawn. So classical Ayurveda system of Indian medicine with its comprehensive approach of ahara, diet, vihara, lifestyle, vichara, medicines, and therapies has a very robust potential to provide rapid and sustained outcomes with abundant safety. We discuss the case of acute trigeminal neuralgia in an elderly lung cancer survivor who was treated with classical Ayurveda approach. Introducing Dr. Zankhana Buch. Dr. Zankhana Buch is a medical superintendent and a senior physician at Sri Shankara Ayurveda Cancer of Integrative Oncology. She has her pioneering work in diabetes, reversing diabetes, and its management in Ayurveda. She has a vast clinical experiences of 13 years and treating many chronic cases and including many oncological co-managed cases also. Welcome, Dr. Zankhana ma'am. I also welcome Dr. Aishwarya Lakshmi, who is our colleague at SSICO. She is a young and passionate Ayurvedic physician who has completed a BMS in SDM College of Ayurveda, Udupi, and then an MD Panchakarma in Government Ayurveda Medical College. She has presented various papers in international and national seminars, and she is also a yoga instructor, certified yoga instructor at S. Vyasa. So welcome, Dr. Aishwarya Lakshmi. So the stage is yours. Thank you.
Thank you, Dr. Rakesh. Namaste, everyone. Dr. Rakesh has covered quite a brief about the disease. So without taking much time, I would request Dr. Aishwarya Lakshmi to go ahead and present the case. Just before that, setting the stage that while we discuss the outcomes, the idea is also to share with all of you that such a debilitating disease where till date there is no definite diagnostic test or an investigation framework to find out. It is mostly based upon its clinical presentation, while neuroimaging plays a role, but various causes are yet unknown. And whatever the treatment that has been laid in terms of conservative management or surgical management still leaves the patient with much side effects and suboptimal care. At that point, it is important that classical Ayurveda's comprehensive approach, which looks into diet, lifestyle, medicine, and therapies, are taken care. Also, today we would like to share with all of you here some of the key Ayurveda procedures that were being taken, like commonly done Nasyam, Karnapuranam, and try to even decode its mechanism and mode of action, that how it would have worked and brought down the inflammation of trigeminal neuralgia. So this, we are confident that this would also open up lot of ideas in decoding mechanism of action of Panchakarma treatments. Over to you, Dr. Aishwarya.
Good afternoon, one and all. So here we are presenting a case of trigeminal neuralgia. A male patient aged 76 years, known case of carcinoma lung. He is not on active treatment. Approached Sri Shankara Ayurveda Center of Integrative Oncology with presenting complaint. Pain over left cheek region, VAS scale was 10 on 10 and chronicity was 5 years. And this complaint had increased or aggravated since 1 month. He was unable to chew solid foods and he was not able to speak fluently. And there was shock-like feeling over sensations over his left cheek. All these complaints were since 5 years and they have aggravated since 1 month. And due to the pain, he often winces, and this is on and off since 1 month. So, brief medical history. Patient has had a dental surgery 6 years back. Since after 1 year, he started experiencing excruciating pain in his left cheek, which developed gradually and was intermittent in nature. Over the period of time, he consulted many physicians and was diagnosed with trigeminal neuralgia, but he didn't get much relief. Now, the nature of pain is stabbing or piercing in nature. Sometimes he also gets shock-like sensation, which is episodic, that is 3 to 4 days in a day. Pain aggravates on chewing food, opening his mouth, or while brushing the teeth, talking, and shaving also. So he was advised microvascular decompression surgery by neurosurgeon, which the patient was not willing to go ahead because of his own health history and the risk involved. Currently, he is on tab Tegretol twice a day, that is one in morning and 2 tablets at night, 400 mg together. Gave him mild relief for some time, but however, 1 month, all the above symptoms have aggravated. It has aggravated to such an extent that he cannot eat solid foods. He is only on liquid diet, and he is hardly able to talk 2 to 3 words once. Because of his speech impairment also, he has approached Sri Shankara Ayurveda CIO for the management of the same Ayurveda. So now let's look into the past history. He is a known case of hypertrophic cardiomyopathy under medication. He is a hypertensive patient. CA lung, adenocarcinoma lung, was detected on March 2020, and stereotactic body radiation therapy was given to the lung lesions, and it was successful, after which there was no any chemo or radiotherapy further. He had a history of chronic bronchitis, and 6 years back he had the dental surgery, after which all these symptoms have started. So the diagnosis according to allopathy is trigeminal neuralgia type 1, which is episodic pain according to Buch classification. It is seen in more than 50%. It is episodic, sharp, shooting, electric pain. So trigeminal neuralgia type 1, and Ayurvedic diagnosis is Anantavata. Now let's look into the Sthanika Samprapti. Doshastu dushtastraya evam manyam sampidya ghatasu rujam sutivram kurvanti sa akshi Bruvi Shanka Deshe Sthitam Karotyashu Visheshatastu Gandasya Parshvetu Karoti Kampam Anugraham Lochanajamscha Rogan Anantavatam Tam Udaharanti Dosha Trayam Shiraso Vikaran. So the Vata Pradhana Tridosha Prakopa is seen along with the Rakta Dushti. This Vata Prakopa resides in Griva and Prishtabhaga, that is back of the neck, Manya, Griva, Siradvaya, that is the Manya Marma is affected, Sampedia pressurizes the nerve at petrous temporal area, or the neurovascular compression of trigeminal nerve is seen, due to which there is manifestation along the area of distribution, prasarana, that is conduction to other sites like periocular region, eyebrows, temple, causing Vata Prakopa symptoms along with Rakta Anubandha. Ganda Parshva Spandana, there are vascular pulsations and pain, Kampa, twitching kind of movement, Netra Roga, ocular diseases, and Hanugraha, temporomandibular joint pain. So Vishishta Samprapti, dosha involved is Vata Pradhana Tridosha, Dushya is Rakta majorly, Ama is Dhatuvagni Janya, and Agni is Dhatuvagni, Srotas is Rasavaha Raktavaha, Sroto Dushti Prakara is Sangha, Vyadi Swabhava is Daruna, Vyadi Jirnata is Chirakalina, and Anubandhi is Anubandhya, it is Swatantra Vyadi. So the condition at the time of admission on 18th February 2022, his sleep was sound, Appetite was good, but he was not able to eat solid foods. He was only on liquid diet. Bowel was clear, but occasionally he was constipated. Vitality was fair. Stress was moderate. Well-being fair. Blood pressure was 150/90. Pulse was 69 and weight was 72.3 kgs. Clinical examination. All the systemic examinations were quite normal, except face. In inspection, he had a slight red bruise in right cheek, but the pain here is in the left cheek. Then palpation, there was grade 2 tenderness in the left cheek. Nature of pain, according to patient, was stab or shock-like pain, which lasts only for 10 to 20 seconds once, but this can be occurring n number of times in a day. Episode is 5 to 6 times. That was a minimum. Trigeminal nerve examination, cotton swab test, there was no any abnormalities. Clenching teeth, it was not possible to clench his teeth due to the intense pain. Prakriti is kapha vata. Risk factors, general aggravation of above symptoms and specific regarding this lung cancer. So diagnosis, trigeminal neuralgia, anantavata, vyadhi avastha is vyakta, vyadhi bala is pravara, and prognosis is krichra sadhya. Rogi bala, deha agni as well as sattva bala was madhyama. Chikitsa siddhanta, we have taken two as per. One is Samanya Vata Vyadhi Chikitsa and then Ananta Vata Chikitsa. So, Kriyamataha Param Siddham Vata Rogapaha Shrunu Kevalam Nirupastambam Ado Snehai Rupachare Vayum Sarpi Vasataila Majjapanai Naram Tataha Sneha Klantam Samashwasya Payobihi Snehayet Punaha Yushair Gramyambujanupair Rasairva स्नेह संयुक्तैः पायसैः कृशरैः साम्ल लवणैः अनुवासनैः नावनै तर्पणैश्चान्ये सुस्निग्धं स्वेदयेत् ततः स्वव्यक्त स्नेह संयुक्तं नाडी प्रस्तर संकरैः. And Anantavata Chikitsa goes like this. Anantavate kartavyah suryavarta haro vidhi siravyadascha kartavyo Anantavata prashantaye आहारश्च विधातव्यो वातपित्त विनाशनः मधुमस्तक संयाव घृतपूरैश्च भोजनं क्षीरसर्पि प्रशंसन्ति नस्यपाने च शंकके जांगलानां रसैस्निग्धैर् आहारश्चात्र शस्यते. So the medical management strategy followed by us was internal medications. We had given, we had advised Ashtavarga Kashaya and Ashwagandharishta. Treatments suggested were Mukhabhyanga, Shiraduma, Pratimarshanasya, Kavala and Gandusha along with Karnapurana. And then next phase of treatment was Sarvanga Abhyanga, Shiropichu and Pratimarshanasya and Karnapurana to be continued. So these were the treatment procedures from the days. During the course of treatment, from 18th February to 23rd February, patient had around 10 to 20% of improvement in his pain. He could only talk few words without experiencing pain occasionally. On 23rd second, that is February afternoon, we observed slight tachycardia. That is before treatment, it was 103 per minute, and after treatment it was around 90 per minute. And patient also had mild chest discomfort. Other vital parameters, BP and saturation levels were within normal limits. So for which we had advised him to seek the cardiologist opinion for his utmost safety, because he was also a case of hypertrophic obstructive cardiomyopathy patient. So he consulted in Jayadeva Institute of Cardiovascular Science and Research Hospital, and then appropriate medications were prescribed for atrial fibrillation, hypertrophy, cardiac myopathy and hypertension. He was also advised, rest for a week. So after that, after a week, patient resumed Ayurvedic treatment on 3rd March 2022 during which he withstood the treatment comfortably. Pain in the left cheek had gradually reduced. He could fluently speak and eat semi-solid foods without pain. So condition at the time of discharge on 11th March, his sleep, appetite were good. Vitality, he was actually feeling better. Instead of initially his state of mind also was kind of less, but he started experiencing, since he could speak fluently and he could see that there was changes, his vitality also improved. Stress was usual, moderate, bowel was clear, well-being was good, micturition and blood pressure also were normal. So these were the outcome, physician outcome scale. Pain over left cheek, which was 10 on 10 on the first day, treatment start day. During the treatment, that is in between, since after third or fourth, it was 0. And at the end of treatment also, it had come to 0. Review on 15th April, it had come to 0. Tenderness, grade 1 to 4. On the treatment start day, it was grade 2. During the treatment, it was grade 0. And at the end of treatment, grade 0. Shock-like feeling. All of these complaints after March, after he took the rest and came back, March 3rd or 4th, it was almost reduced. So he was able to speak fluently. Initially, he was only able to talk 1 to 2 words, and that would trigger his pain. But later he started speaking fluently without any pain or with mild pain. And at the end of the treatment, it was without, he could speak fluently. Unable to chew solid foods. He was only on liquid diet initially. During the treatment, he could take semi-solid to solid foods. And at the end of treatment, he could take solid foods. Tab Tegretol, this was 200 mg. So during the start of the treatment, he was taking 1 tablet morning and 2 tablets at the night. During the treatment, we had slowly tapered to 1 in the morning and 1 at the night. And at the end of the treatment, he was only taking 1 tablet. And over the period of time, he takes it only on SOS. That is when occasionally he gets the pain, he takes the tablet. Sleep was good throughout. It had improved after the treatment. Agni was sama. And Mala, initially he was constipated little, occasionally constipated during the treatment, and later it is clear. Mutra and state of mind was poor initially, fair during the treatment, and after the treatment it is good. Standard outcome scale, the brief pain inventory, facial, pain scale 0 tells it does not, the pain doesn't interfere in his work, and 10 says it completely interferes in the work. So these are the set of outcomes. In general parameters, it was in fact completely interfering in his works. During the treatment, he had rated it 5. At the end of treatment, 0. Mood review after a month, it is 0. Walking ability and household work, relationship with people and sleep, it hadn't disturbed, pain hadn't disturbed. Eating a meal, it was completely interfering initially, and he rated it 2 during the treatment. After treatment, 0. Touching the face, 10 initially, 2 during the treatment, and at the end of treatment, 0. Smiling, he rated it 6. That is, occasionally he gets pain when he smiles or laughs, and he rated it 2 during the treatment. At the end of treatment, 0. Opening mouth widely, even now he comparatively doesn't do that with the fear of getting back the pain. So 1 is the rating. And eating hard foods. Now currently after review of 1 month, he can eat apples or any hard chapatis also, he can eat it well. So patient global impression of change. So 1 to 7 is the rating, in which patient had rated 7. That is, he was at very much pain during the start of the treatment. But at the end, he has rated it 1, very much improved. Now, patient outcome scale, pain over left cheek before treatment was 1, that is poor. And after treatment 5, review after 1 month, he has again rated it 5 only. Unable to chew solid food, patient was not able to do that, so 1. And after treatment 5, review after month 5. Unable to speak fluently before treatment 1, after treatment 5, and review after 1 month 5. Discharge medicines, internal medications, Ashtavarga Kashayam, Ashwagandha Arishta, Haridra Khanda, Servilon, and Anuloma DS was given. Haridra Khanda was specifically given for his bronchitis complaints. Patient had asked for some Rasayana Chikitsa for that. Then external medication, we had advised him to have mild Mukhabhyanga with Carbamazepine Taila, Pratimarshanasya with Anutaila to be continued, with Carbamazepine Taila also to be continued. Now I request Dr. Zankhana ma'am to summarize the presentation and give us the take-home points.
Thank you, Dr. Aishwarya. So from this case, we have a lot of takeaways to share and also request your thoughts for discussion. First of all, this is a case of an isolated presentation of trigeminal neuralgia, where patient had a history of dental surgery 6 years ago. Post that, like, there were severe and varying episodes of pain for which he had been to neurologist and had gone through a series of investigations. During that course of time, till he approached Ayurveda, he also had developed CA lung, which he had come through his treatment of chemotherapy, radiotherapy, and was through. So at this point, first thing that I would like to share with all of you is that while trigeminal neuralgia and dental surgery has a connection, it has been shown in literature that trigeminal neuralgia is one of the predictive or premonitory sign of CA lung. Many of the patients do develop no other symptoms but cheek dysesthesia, that is known as severe cheek pain. So in this case, we tried to go through the process of evidence-based diagnosis. That is a first step that is laid down. That is this Vyadhi coming out of any other roga? Is it a Nidanarthkara roga or a Swatantra Vyadhi? We had a round of discussion with the treating oncologist, and it was found that this had no correlation with lung cancer that was there. While in any other case, trigeminal neuralgia could have been a first sign of CA lung that was developing. Post that, going to the second step in treatment of providing evidence-based medical management plan. So with complete diagnosis of Ashtasan, Dashvit Pariksha, Sroto Pariksha, and laying down here a key focus on Vishisht, on Sthanik Samprapti Vighatan. We did keep the Vishisht Samprapti, but here, if, as you can see, considering his age, considering a local pathogenesis that was happening, our key focus was more on the external therapies and medicines, diet, and lifestyle. So medical management plan was clearly laid on that principles. Comes to the point of evidence-based provision of care. So here, key thing that I would like to share with you that the treatment was monitored throughout, and during this time, we did observe patient had tachycardia. While was that a vyapat of any of the treatment that the patient was undergoing? We did a thorough assessment and analysis, and we did come to a point that probably because he was on an increasing dose of nasya during that time, he had shown some signs, possibly a vasovagal reflux that could have happened. But considering 76 years old age and a history of obstructive cardiomyopathy, we did not want to take a chance. And keeping that in mind, we did discuss with the patient to have a review with his known cardiologist. With that, it was ruled out that he did not have any of the complications or side effects of the treatment that he was undergoing. It was just that the history of atrial fibrillation and obstructive myopathy was re-reviewed. None of the things that were happening had led to any of the side effects or any complications. So we were very safe at that point in providing provision of care. Last point, sustained well-being. While Ayurveda treatments, mostly like when it is Purva Karma or when plan is like focused on only local things, there is a chance of relapse and recurrence. Therefore, we kept in mind that patient was continuously reviewed, and till date that patient is in touch with us. So while the focus was more on the roga, we did look into a person, a 76-year-old, who had come to us with a severe pain, and in between who had gone through a very scary diagnosis like cancer. So we could imagine his state of mind. While he had been to neurologists, we found that difference of care was also in hand holding. While he came in, he was literally in tears and that nobody to reassure him. So during this while of 14 days of care, he was engaged. His all concerns and queries were addressed. He was reassured on his vital parameters. We do feel that while rest of the things did play a role in Samprapti Vighatan, touching his manas, taking care of him also played an equivalent role. So here, these key points we think have really helped to take care of him. Could you just take down Dr. Aishwarya? So here, we want to share that we saw a dramatic response, like patient underwent the first round of Karna Purana on first floor and he was so excited and amazed. He came down, he held our hands and he said that my pain is zero today. I can tell you that I have no pain. So this was a moment for us to stop and think through. We sat, Dr. Aishwarya and we found out that what could have, while we knew that this Samprapti Vighatan would happen with kind of all snehana that is happening, but what is it from an anatomical perspective that could have changed? So we found that there is clearly an association between otic delivery of drug. Ayurveda has this amazing insight of just other than oral, different routes. Karna Purana is one of them. Shrotra is a Vatasthana. Karna Purana Taila, which was done Karpasasthyadi, is Vatakafahara. It is Brahmana. So if you look at the origin of trigeminal nerve, it definitely has an connection with the auriculotemporal nerve. The moment Karna Purana was done, it brought down the pressure and patient had an immediate relief in his pain. Similarly, we found that nasal cerebral mechanism. So while we all carry out Pratimarsh Nasyam, Nasyam, in many of our cases related to Shiro Rogas and upper clavicular. But here what we found that when Nasyam was carried out, it could have definitely crossed the blood-brain barrier in terms of two pathways, the olfactory pathway and the trigeminal pathway. So with that, probably we are of the view that it could have crossed that and all the polypeptides, mucus, epithelium, lamina propria, all of those stages in the anatomy has been addressed, which probably is a cause of sustained relief. And then, so these two things, here you can see we have tried to bring from an allopathy perspective. This is the artery and the thick one is a trigeminal nerve. In between a sponge or a pad is put inside to stop the stimulation or irritation of nerve. This is a very risky procedure, which is known as microvascular decompression or a Jannetta procedure, where a flap is opened up and a sponge is inserted. A study shows that there are various neurological risk factors because it requires like an opening and leads to various infections, stroke, etc. Considering his age as well as his overall cardiac history, patient was not willing to go for Jannetta procedure, but this is routinely which is prescribed. So compared to this, we have on parallel side Ayurveda framework of Sthanik Samprapti Vighatan, considering the Vishisht Samprapti that has happened, and care on diet, lifestyle, medicines, and of course, his state of mind. So we find here that from the guidelines that are laid down for trigeminal neuralgia, which includes classification and to establish the diagnosis on various points, and as well as non-pharmacological, pharmacological, and neurosurgical treatment, the algorithm that is there has definitely a scope to revisit, where Ayurveda therapies, Ayurveda approach can be considered, where integrative management is possible. And with this, I would like to request all of you for your questions and thoughts. Our reference for today has been Charak Samhita. We have referred Vata Vyadhi, Ananta Vata as a core thing and chosen very common, very classical medicines like Ashwargam Kashayam, Karpasyastyadi Tailam, Ashwagandha Rishtam, and all procedures which are classical. With that, I would like all of you to request your thoughts.
Good afternoon to everybody. I'm Dr. Bhatt here. It was a very nice presentation by Dr. Zankhana and Dr. Aishwarya Lakshmi. See, trigeminal neuralgia, we compare it to Ananta Vata. Yes, we can very well compare, and we can diagnose according to the symptoms. According to the symptoms, we can do it. Even in modern medical science, it is very difficult actually. Only by the symptoms they also diagnose it as trigeminal neuralgia. Only one patient, yes, always we present only one patient, but my feeling is actually, we have to actually present, at least about 10 cases we have to take, and then, we have to conclude the total. This one patient may improve, of course. In all our conferences, what we do is, we present one case. If we can actually take, at least about 15 cases of, same disease, like, trigeminal neuralgia, if we do it, if different, cause. In this case, probably the dental surgery may be one of the causes, what I feel. And his old age. Old age usually, in old age, usually what happens, the vata increases, and he has already received cancer treatment, and so many side effects may be there because of the cancer treatment also, and dental surgery also may be one of the causes. Maybe in some other cases, some other causes may also be there. This is the thing actually which I want to say. Few more cases of, this one can be taken, because when we take any particular case, and when we say that this patient has become all right, because trigeminal neuralgia, he was having, this patient was having a 76 years old patient was having since about 5 years, but since 1 year it was actually more. They don't even allow the doctor to touch. Not even the patient can touch by his own hand, actually. He cannot actually put his hand on the face, on the play. See, ophthalmic branch, maxillary branch, and also the mandibular branch. So less is affected this one, but more maxillary, and these branches are more affected because the irritation and the neuritis will be more in these areas. So when he doesn't allow the physician to touch, or he doesn't allow anybody to touch actually, and even the CGs cannot actually put their hand with massage, we cannot do it actually, in such cases, it is so difficult. In mild cases, of course, they allow to actually put the oil, do the nasya karma, do the svedana karma, all these things. It is so difficult actually, because we have treated more than 22 cases of trigeminal neuralgia. And we have experienced that this is one of the great problems we get actually. So we have to collectively, we have to take all these patients and then say, so what is the total outcome of these 20 patients? So not only that, this treatment has started, in the month of March. Now it is only, beginning of May. So we may have to actually follow up the case, because relapse and recurrences are very, very, very common in this one. Because I have a case who is having this particular trigeminal neuralgia since more than 10 years. But he is still coming. But sometimes he is okay, but he is still coming for the treatment. And because the relapses are very common, so you have to follow this particular case further every month, so that we can confirm that yes, even after 1 year, there is no relapse. Because the outcome scale, so out of 10, it has become 0. It is really wonderful. It is really wonderful. So out of 10, it has become 0. And in the same way, all the parameters which were actually showing very severe pain has reduced very much. Today, he is very much better. But after some time, probably we don't know. So we may have to actually follow the case. And oil application, maybe more of Carbamazepine thaila we use earlier, but we use more of Mahanarayana and also Ksheeravala thaila. This oil combination, probably, I don't know, my experience says that it is much better to use it. And
could you explain the logic for the difference, Dr. Buch? Why would you choose these medicines over Carbamazepine and the other medicine? Is there a medical logic? Yeah.
Yes, Mahanarayana thaila contains the Shamula and different other, about 40 ingredients which are more pain-killing effect, than the Carbamazepine thaila. Carbamazepine thaila may be more Kafahara than Vatahara. Mahanarayana thaila is a in Shula Pradhana Mata Vyadhi. We use Mahanarayana thaila, and in Vata, if it is much more, then Ksheeravala and Mahanarayana thaila, in our experience, probably that is a good thing, what I feel.
Is there anything contraindicated in the use of the oils that has been used?
No.
So there is no contraindication.
No contraindication.
Okay, number 2, the 22 cases that you managed, would you have the case papers we can refer, Dr. Buch?
Here we don't have. Here we have treated about 3-4 cases.
Yeah. So if we can get that, then that will help to develop a case series, because otherwise, this is a case report presentation. So we are looking at the understanding of one case now. So we'll go deeper into that, Dr. Buch.
So all cases.
I understand. Yeah. So I think if your documentation is also shared, then I think they'll be able to do the analysis.
Yes.
Yeah. Okay. So apart from the oil choice and the fact that we need to do a case series, any other points, Dr. Buch, you'd like to comment on the?
But the only thing is we have to actually follow the case from one.
No. So I think the good thing, Dr. Buch, just if I may respond, I think the good thing is that they have tracked it even after a month, and that is still the sustaining of those parameters is there. So at least to the point, the patient has taken treatment only 1.5 months back. So far, so good is the point, right? So I think we'll follow you. As you know, we all follow the case throughout. So that will be definitely done without saying. Yeah.
Yes.
Madam, I have a question.
Yeah. Sorry, Dr. Rakesh. Just one point that I would like to answer to Dr. Bhatt's point, that patient did come in that level of severe pain that his hand would be constantly on his cheek. So before starting any external therapy with pressure, we did begin with a no-touch thing where we went ahead with doing a Kshirdhumam, which helped to bring down his pain to an extent. Once that level was achieved, we began slowly with the therapies which involved a physical pressure, one. And second, on choice of Karpasasthyadi, it being Vat Kafahara and patient showing that kind of predominant doshas, it was chosen. And he did show a response corresponding to the medicine that was chosen.
Yes, very good. Thank you.
Yes, Dr. Rakesh.
Yeah. So, ma'am, regarding the diagnosis, I have a question because one thing is that, trigeminal neuralgia is like, usually caused by an intracranial artery, which could be an inferior cerebellar or basilar artery. That compression to the trigeminal nerve is the cause. Have we ruled out any tumor or atrophies or sclerosis of any of the sort to rule out whether it is early established in trigeminal neuralgia? Is my first question, number one. Number two, since the pain is predominant, definitely it is Vata Pradhana. How did we establish that the Vata Pradhana is because of Dhatukshaya or Srota Avrodha or due to both? Because the treatment what we have done is the Brahmana. So I assume that it was on Dhatukshaya line of treatment. But there is also a Srota Avrodha because it's a known case of hypertrophic obstructive cardiomyopathy, which means Srota Avrodha. So there's a two subprapti happening parallelly. So in this condition, how did we take a call that you have to go for a Brahmana line of treatment, which is Ashtavarga is also Brahmana, Ashwagandha is also Brahmana. So Dhatukshaya line of treatment is taken. So what was the call taken to differentiate between Srota Avrodha and Dhatukshaya in Vata Vriddhi? These are two questions which I have.
Yeah, so the first question that he had undergone like complete investigations, right, from MRI, CT brain, PET CT, because he was recently undergoing CA lung. So all space occupying lesions, intracranial lesions were all ruled out. Where we could relate only one thing was an external cause. Probably he had undergone a dental surgery, which was 6 years ago. And he did say that post-surgery, there was a trigger. And on the same side, that we assume that there could have been a nerve damage that could have led to so much of a pain. And it has been continuous. And the second point that while I made it also very clear that there were two sampraptis that were happening simultaneously, he did go through all kapha kind of conditions at one level, right from all hypertrophic cardiomyopathy to lung lesion to other, like if you look at his bulk for his age, he was bulky, right? But at the same time, having gone through CT, RT, his own avastha, which is Vata Pradhan, right? He had undergone, assuming that it was an Agantuk Nidana, we clearly found that Vata Dushti, which was there. So we thought that we should focus it in both the ways. We do extreme Vata Shamana locally. We build him through that line of Dhatukshaya systemic. So the choice of medicines could have been Rasna Saptakam, could have been Dashmul or Gandharvastadi, which are Param Vataharana. Versus that, we chose something which could balance both. I think that combination of both these things, tackling Vishisht Samprapti as well as paying attention to the local Samprapti with Vata Pradhan, like two distinct things which are opposite in nature, but done at a simultaneous time, has helped.
Yes, ma'am. Now, Srota Avrodha condition is technically tackled with Rukshana or a Langana type of therapies. Whereas Dhatukshaya is done with the Brahmana line of therapies. Here, both the therapies as well as the medicines was of Brahmana type. Ashtavargam, Ashwagandharishtam, Karnapuranam, Kshiradhumam, Nasyam. Of course, Nasyam oil was Karpastesadi, which is Ruksha Stigdha, which can be attributed to remove the Srota Avrodha. But Brahmana oil was not done. So that internal medicines were Dhatukshaya. How did you tackle the Srota? I mean, Avrodha Avastha is what I was thinking. Means, how did you tackle?
Yes.
Yeah.
So the point is that that thing of Srota Savrodha, in this case, more than a systemic Srota Savrodha, was a trigeminal compression, because even his allopathy conventional line of treatment was decompression, that the flap would be opened and that would be removed. Had we done, like, we did not try to copy that and do something which would do that, but we did feel that there was a logic in that, because it is an anatomy which is involved. Most of the times that we are caught in dealing Srota Avarodha at a systemic level, we should do that. But where an anatomy demands an attention, we cannot miss that. So probably that's where I said the process itself of instillation, whether we did it through Karna Purana, we did it through Nasyam, made a dramatic difference. But now maybe your point is right. The next level of study or a comparison should be on choice of oils. While in this case, we did find that he showed like significant change from pain 10 to pain 0 in very less number of days. So I think so it is more also, of course, the quality of drug has made an impact, but the procedure chosen did work. It did bring down that load and irritation on trigeminal nerve, which has worked.
Okay. But yeah, but why wasn't a systemic treatment like Snehapanam, that is Nishi Snehapanam, which has an Urdhva Jatrugata Rogas, or a Virechana, which has a tendency of in Raktavaha Srotas, where the Raktavaha Ashraya can be reduced? Why wasn't that been considered then, if both
Yes.
Srota Avrodha and Dhatukshaya was taken in consideration?
Correct. That was also a point, that he's 76-year-old, a lung survivor, right? And his state of mind. Now I need to look into a patient completely. If I put him, probably I should think this for a next case, but I try to choose to begin it in a way where I and my team are able to be with him throughout the care, right? And he was more like, he had been to a lot of people, lot of physicians, and everybody with of the same opinion. Now it was a time that we as physicians had to take over rather than asking him to do something. So that was also one point that we felt that we really need to show in terms of doing therapies, taking care of him. While there was no technical thing that we asked him to do a Snehapanam, he would do it. But we did consider his state of mind as a first thing above all, in trying to give him that maximum relief in short number of days. And had it been a younger group, a younger patient, I would definitely consider giving focus to an internal thing as much as I would to the external thing.
Okay. Yeah. And one more recommendation from my side would be that
Yes.
as a rasayana, as a rasayana, some snigdha medicines can be given at since it's been almost 1 month, to tackle the Dhatukshaya Avastha in the form of Thailam or Gridam will be better. Is my suggestion.
So we have started him with a Ghritam recently. He is asked to be on Sukumar Ghritam recently, considering his age and his profile.
I would also like to add a few points here. The Nasika Taila which was used was Anu Taila, which acts both as Shodhaka as well as Shamana. It has both the effects, as well as the Karpasastyadi Taila is Ushna as well as Brahmana. So the Ushna helps in removing the does the Shtotos Shodhana. Also the Ashtavarga Kashayam is also a little, it is Vata Kafahara.
Brahmana.
It is Lagu Ruksha as well as Ushna, which helps in tackling the, it does the Shtoto Shodhana action itself. So I think we had selected these medicines according to the both these therapies together.
Dr. Zankhana, I have a quick question. You talked
Yes,
about
sir.
the connection between trigeminal neuralgia and lung cancer. That seemed to be quite an extraordinary correlation. So is there anything in modern medicine to establish that correlation, and anything in Ayurveda to establish that correlation?
Yes, sir. in modern medicine, clearly there are papers and it is shown as trigeminal neuralgia is shown as a rare presentation of lung lesions that are involved. Also, that is probably in advanced cancers with metastasis. And this is purely based on anatomical correlation that they have found on PET CT scan. With respect to Ayurveda, we do, as per in Vata Vyadhi, it is told that it is avyaktam. Many of the conditions do have purvarupas and many don't. While there is no correlation as such between Arbuda and a thing like this. But however, we did find that for such a kind of a profile of a patient who came in with a severe pain, certainly that anubandhya of Swatantra and Partantra Vyadhi was thought through rigorously, whether this is an isolated condition or is it something that is coming from within. And we could not, however, find any correlation except for the fact that there was an anatomical nerve injury which happened during dental procedure.
A small point to Dr. Aishwarya. You talked about the Agni and the Dhatu Agni being affected, the Jatra Agni is not affected. But when you talked about it later, you told it is Samagni and Nirama. So I just wanted to ask, which Ama were you talking about? Which Agni were you talking about in the outcomes? And what were you talking about in the initial part?
In the Sthanika Samprakti, it was the Dhatu Agni which was involved. And in the outcome scale, I was talking about the Jataragni. He was feeling good appetite, but he was unable to eat anything because of the pain. He was only on the oral intake, liquid diet.
Okay, thank you very much. I will pause here.
One more thing I would like to say here. In classical texts of modern medical science, we read, these trigeminal neuralgia. Female are prone to get, trigeminal neuralgia than men. Have you come across that particular thing? Because it has been clearly mentioned in modern medical science text, but in Ayurvedic text, it has not been mentioned. That is not there. Just like the rheumatoid arthritis, very commonly it has been this one. In the same way, they have mentioned female are more prone to get this one. This is one thing. Second question is, we may have to ask, all these dentists, actually, at least a few dentists, we may have to ask what is their experience after a root canal treatment, whether they come across, this kind of trigeminal neuralgia cases. This also we may have to ask them and get some more information so that it will be adding to our Ayurvedic, the understanding and the understanding the cause of the disease.
Yes. So to your first question, Dr. Bhatt, as of in my experience, I have not seen that prevalence in females more than males. Till now, whatever has been dealt has been coincidentally maybe has been in males only. But probably would like to study that if there is any gender specific risk factor which is there, because this anatomy is uniform. But from an Ayurveda perspective, quickly that what I can think aloud is about women being Sukumar, and that pain perception would be more, but whether it is perception of pain, reporting of pain, is it that which is leading to more presence, presentation and prevalence in females, or it is actually because they are abala, it is seen in them? That also needs some more observation. And your point is right that we need to collaborate with the dental surgeons and to find out the incidence of TMJ that happens and how do they manage. Mostly we have seen that it is suboptimally managed. Patient continues to be in pain irrespective of medicines. And one more important thing that we could not discuss and we missed that I think we should is that carbamazepine, tegretol is a mainstay of this treatment. And mostly when patients come to Ayurveda, they are on this anticonvulsant. So we as Ayurveda physicians should be very careful and mindful on tapering that, and should not be an abrupt withdrawal, because apart from the pain, since it is an anticonvulsant, there are certain risk factors even in tapering that. So we should keep that in mind while tapering carbamazepine.
Yeah. I would like to add one more thing here. When we do the treatment for trigeminal neuralgia cases in Ayurveda, we try to actually take the cotton dipped in the oil, and then we just touch on the particular part. We don't actually put the hand, because the pain is severe. They don't even allow. So we actually take the cotton, just dip in the oil, and then we touch on those parts, so that the and then we also take the milk, and then we actually put the cotton in the hot milk, very lukewarm milk, and then we touch after that becomes a kind of sneha and svedana, what we follow. My experience, I'm telling you.
Dr. Zankhana, and also to all the Panchakarma MDs in particular in the group, the thing that Karnapuranam caused some decompression inside, that particular hypothesis. Is there any study which talks about Karnapuranam and what it does inside? And if not, if there is no such study, is there any thoughts on how we can establish that mechanism that by doing Karnapuranam, it leads to certain things? So both what is the status as on date and what can be done basis the state?
So we did a
because you made a hypothesis which is not backed by any proper study to tell that that is indeed the case.
Yes, we did a quick literature search on Karnapurana. We have found only review studies. We did find clinical study on comparison, but its mechanism of action has not been reported. We made such a hypothesis based upon our clinical observation in this case. While it may not be true, but we should test this out in multiple cases of trigeminal neuralgia and orofacial pain of different origins. But what we found is that when we did a quick search on auditory and inner nerve and trigeminal nerve correlation, we did find that the auricular connection, there is a connection with those nerve fibers, and probably Karnapurana helped to pacify that irritated nerve that was inflamed. Probably we thought that could have been the reason.
Because it's too hypothetical, so it's good to make a point that worked, but I think going beyond that would be a little premature, and we should look at establishing. So any of the MDs in Panchakarma have got any point of view on Karnapurana? Dr. Aishwarya, Dr. Sushma, and others. Dr. Bhatt, any thoughts on it?
I would like to say,
yes, please.
Srotrasti sparshanendriyam kati, and this one, the karana is actually one of the places for vata. So when we say that when how to control vata, so shira shravana padeshu tam visheshena shilayet. So when we have to control the vata vyadhi, shira, shravana, pada, we have to actually take care. So that's why when we put karana, when we do the Karnapurana, probably the vata which has been aggravated in the urdhva jatru may be taking care. That may be one of the reasons, according to Ayurveda, I'm telling, Shrotrasti sparshanendriyam. So this one, Shrotra, is one of the places of vata. So probably vata is going to reduce, by doing the Karnapurana. This is one of the reasons what I feel.
Any more queries? Any more discussions? So we'll wind up the queries and discussion sessions. So the key feedbacks are that it was a wonderful sessions. Thank you. Congratulations, team Sri Shankara Ayurveda, for presenting us a beautiful case of trigeminal neuralgia, Anantavata. We also would want from other centers a case repositories so that we can come up with a unified protocol on treating this trigeminal neuralgia. So unified plan of action or pharmacodynamics or pharmacokinetics of the medicines can be retrieved with this, as Dr. Buch sir has said. Moreover, the scope of studies is the study of Karna Purana, which is the action treatment for reducing. The scope is there to understand that what is the action of Karna Purana. There can be many postulates, there can be many theories, but what could be the proven action of Karna Purana? Then the another takeaway point would be that the correlation between a cancer or lung cancer and trigeminal vein, which is a very keen takeaway message, because we physicians did not have any idea that there could be a possible chances of a cancer of lungs. Hence, with this, we would thank Zankhana and Dr. Aishwarya for giving us the informative sessions. Thank you, viewers. Thank you for the bright and lovely discussions. Good evening. Thank you.